Hello, my name's Terry Simpson and I'm Mental Health Lead for South Central Ambulance Service. I wanted to talk to you today about the ongoing challenges we are having through COVID and the impact that's having on our mental health and well-being. Within the ambulance service and specifically SCARS, we have taken an approach to really try to adapt our response on how we support people through this very difficult time. In doing so, what we've done is we've broken this down into 3 different areas. So what are we doing for the mental health and well-being of our people, the employees of SCARS, our patients, the patients we respond to either through 111 or 999, or our partnerships and how we adapt and adopt new ways of working with our key partner agencies such as police, social services, AMP services, voluntary sectors, and mental health provider trusts, of course. So in order to sort of try to think through how we respond and improve our well-being, we've got to look to start with as acts of self-compassion. We can only be compassionate to other people when we really start to be compassionate to ourselves. So in order to structure that, what I'd like you to think about doing is taking 5 for mental health. So what we mean by that is the 5 ways to well-being, or more commonly known as social prescribing. And they focus on how we connect. So try to think about our relationships, the people we know, the time we spend with our friends and family, reaching out to people in distress, making sure that we're taking time to talk to each other with compassion and empathy and understanding, and remembering we've got 2 ears for a good reason, twice as much listening as talking. So really important to try to think about how we connect with other people. Taking notice of what works well and your own stress levels and how you're doing that day. And again, we're acts of self-compassion. Think if you feel overwhelmed, it's okay not to be okay, and it's okay to reach out to somebody for help. Think about the importance of giving, those random acts of kindness and the impact they can have on people's lives. So small gestures can make a really big difference. As simple as holding the door open for someone, a smile, a nod, a wave, making someone a drink if they look lonely or sad or distressed or upset, can really make a big difference to their day. Think about learning new ways of coping. So it might be new hobbies, interests, new activities, different approaches to the same challenges. So sometimes looking at a fresh approach to that challenge might be really helpful. Think about regular exercise. We know that regular exercise can have a really big impact on boosting endorphins and oxytocin, which are natural feel-good emotions. So if you reflect back to either that walk or run or cycle, or as well as the physical health benefits, it really can give us good mental health benefits from switching off and finding ways to refresh or reframe how we think about what might be adding some occupying our thoughts or dominating levels of anxiety. So those 5 ways to well-being can really make a big difference to people, and obviously to our own personal resilience, and it really is important to try to think those through. Of course, in addition to that, if people do need clinical help, please do reach out to your GP or doctor or the NHS overall. We are here to support everyone through this crisis. Other options, of course, which are helpful for anxiety, stress and depression, are counselling, and where clinically needed, medication can really help people too. So I just wanted to also talk through about what we're doing for our patients and our partnerships. Within SCARS, we know that having mental health nurses in a control room is having a very big impact on them 111 and 999 service, so we can ensure that people have timely access to the right care first time, every time, so they can have some counselling and support, or practical advice, and someone to listen with a non-judgmental approach where that's needed, and that can really help people, and they can also signpost people to the right care and support. So really we're working hard with our partner providers to improve those options, and in addition to that, trying to think about how we support people with complex care needs who frequently present in multiple services, so that they get the right care, and if they need a higher level of support, that we find the right support mechanisms in place as a system rather than working in individual organisations. And then lastly, of course, I wanted to talk about our partnerships. And within SCAS, we are working very closely with key acute hospitals, ED departments, mental health provider trusts, and AMP services. I'm pleased to keep people safe at this difficult time. What I would say is please remember that you're never on your own. It's okay not to be okay sometimes. We're all facing the same challenges. And please also remember that just because we might be struggling doesn't mean we're failing. So do please reach out to that person or reach out for help yourself if you need that help. It is always there. We will find a way to support you through this difficult time, and we will be stronger together. Thank you very much. Bye.